Sarcoma is a rare but treatable disease, often referred to as the forgotten cancer. It happens when malignant cells form in the bones or soft tissues of the body. Dr. Daniel Lerman is an orthopedic surgeon with Colorado Limb Consultants over at Presbyterian St. Luke's. Doctor, why do we call it a forgotten cancer? What's the message?
Sure. It's called a forgotten cancer because it's a relatively rare cancer. So it's never the first thing that pops up on somebody's mind or somebody's radar when they see a mass or see a lump. Oftentimes, things get dismissed as simply, quote, a lipoma or some other benign process out of hand because those are exceedingly more common.
Are there different types of sarcomas, doctor?
Yeah, as you mentioned, the two large categories that sarcomas fall into are bone sarcomas and soft tissue sarcomas. Soft tissue sarcomas represent cancers that arise in the fatty tissue of the body, the muscles, nerve tissue, things that we have in our extremities in the musculoskeletal system. Even within those large categories of bone sarcoma versus soft tissue sarcoma, there are certain subtypes. And in the world of soft tissue sarcoma, there's approximately 65 different subtypes of soft tissue sarcomas, some of which have very specific behavior and patterns of spread or sensitivities to certain treatments. So if one is diagnosed with a sarcoma or worried or concerned that they may have a sarcoma, it's very important to seek specialists who have expertise in sarcoma treatment and in sarcoma therapy, because the management of them is very specific. Not just within sarcoma itself, but within these different subtypes based upon what they may be.
Yeah, I want to go back to something you mentioned, doctor. It's often misdiagnosed. Often misdiagnosed as what?
So what we see with more regularity than we would like is somebody has a lump or a bump on their trunk or on their arms, their thighs, where have you, and it gets called something without a true diagnosis, and it gets excised or taken out.
Okay.
And it's taken out in a manner that's inappropriate for a cancerous process, meaning it's taken out either piecemeal or it's taken out while leaving some of the cancer behind.
Let's talk about screenings, anything people can do in terms of prevention.
That's always the million-dollar question.
Yeah.
And for better or for worse, there is no screening protocol that has to be done for sarcoma. Sarcomas are incredibly rare. So screenings are most effective for diseases that are more common or more prevalent. So there's really no good effective screening for rare diseases. But just because there's no screening doesn't mean we shouldn't be conscious of them being a possibility or them occurring. So the things that I suggest people look out for is in bone sarcomas are oftentimes painful, and it's an insidious deep throbby pain that you can't quite put your finger on, you can't rub away, you can't itch away, because it's a deep kind of a toothache type pain. It's a pain that typically is worse at rest or even at nighttime. And then when you're more active during the day, it's really not as prevalent or not in the forefront of your mind. So if one has a deep, achy, throbby pain for a prolonged time, just don't dismiss it out of hand as some potential injury or growing pains or what have you. It's worth just having an image, having an investigation, and having evaluation by somebody who has familiarity in this area.
Yeah, and I guess, doctor, it's like saying if your body, sometimes our body is trying to tell us something is really wrong, you got to listen.
Listen, and not just listen to your bodies, but also be an advocate for yourself and be an advocate for your loved ones. Because there are people in healthcare are very well-intentioned. And unless you specialize in sarcoma, you don't really see it. And if you don't see it, it's not the first thing on your mind. So I suggest that people, if something doesn't feel right, if even a physician's response, seems dismissive or reassuring, but maybe not without actual data to back up that reassurance, it's worth just diving a little deeper and understanding it a little better.
Thank you so much, Dr. Lerman, for all these terrific insights. And everyone, we'll put resources and more info on sarcoma at cbscolorado.com.